Assalamualaikum warahmatullahi wabarakatuh. Good evening to all ladies and gentlemen, all Duta BPJS Kesehatan all over Indonesia. Welcome to the Initiative National Debate Competition INDC 2024. It's very good to see you guys here again. So before we start, we want to make sure that you're joining the right room, which is now you're watching round 32, session 2, room C. And this evening, we will witness an interesting match between Team Papi's Angels 2.0 from Capwheel 9 as the affirmative team versus Yogyakata team from Capwheel 6 as the negative house. First of all, I would like to introduce myself. My name is Fadila Tairani. I'm from Kantor Cabang Kendari, Kedeputian Wilayah 9. And I will be your moderator for this evening. So, also, I would like to say hi to our honorable adjudicators that already joining this session. The first adjudicator is Mr. Ichwansyah Gani. Good evening, sir. How are you?
Good evening. Good evening, guys.
You.
Thank you.
And then the second adjudicator is Mr. Achmad Krisnawan. Mr. Achmad Krisnawan. Hello, sir. Good evening.
Good evening. Assalamualaikum warahmatullahi wabarakatuh. Have a nice evening, guys. Thank you.
Okay, and then for the third adjudicator, we're still waiting for the adjudicator to join this Zoom, this session. And for the honorable adjudicator, please let us know if there's something to be cleared out. And thank you once again for joining this session. And thank you for giving up your precious time for INDC 2024. So here we already have two teams that join this match for tonight. And I want to introduce them to all the participants here. So the first team is Papi's Angels 2.0 as the affirmative house. We have Miss Rika Permatasari as the first speaker. Hello, Miss Rika.
Hello, Mbak Dila.
Thank you. And then we have Miss Jihan Hairiah as the second speaker. Hello, Miss Jihan.
Hello, Mbak Dila. Is my voice clear?
Yes, we can hear you clearly.
Good evening,
Thank
everyone.
you. And then lastly, I want to say hi to the third speaker of the affirmative house, Miss Triska Alia Mutia. Hi, Miss Triska.
Hi, Mbak Dila and other participants.
Thank you. They're also with their counselor, Mr. Muhammad Afyuddin. Mr. Afyuddin, good evening.
Good evening, Ms. Dila.
Thank you. Okay, so we're moving on to the opposite team, which is the negative team, is Yogyakata team. As the first speaker, we have Miss Trisna Ningsih. Good evening, Miss Trisna.
Good evening, Miss Dila and the other team member.
Good evening, thank you. And then we have Miss Bunga Adinta as the second speaker of the negative house. Hi, Miss Adinta.
Hi, Miss Dila.
Okay, so the third speaker from the negative house, we have Mr. Angga Primasandi. Good evening, Mr. Angga.
Hello, good evening, Ms. Dila.
Okay, thank you. Also, they are here with their counselor, which is Mr. Muhammad Subhan. Good evening, Mr. Subhan. Are you here?
Hello, good evening, Miss Dila and the others.
Okay, thank you, Mr. Subhan. Okay, so also I want to say hello to all the audience in the chat rooms in this Zoom meeting. Everyone is open to give their support and cheer for the favorite team that is on the match this evening. But please remember that this is a safe space, so make it positive and be respectful to each other. Okay, so before we start, allow me to read some small rules for all participants. The first is no participant are allowed to open their microphone before their own turn. And then the second, team member must rename their Zoom name into the format team name underscore the first, second, or the third speaker. And I can see that you guys did that already. And then the third is each team member joins with their own Zoom account and not allowed to join in sharing account. And the last is the operator may do the necessary thing to make sure that this session runs smoothly. Okay, so ladies and gentlemen, our honorable adjudicator, without any further ado, let's start the debate for tonight. So before that, I want to remind you guys about the motion for this session, which is BPJS Kesehatan needs to increase the premium of Jaminan Kesehatan Nasional to sustain the program. The premises is the premium of Jaminan Kesehatan Nasional refers to the contribution or fee paid by the participant to the Indonesian National Health Insurance Program. BPJS Kesehatan faces critical financial challenges that jeopardize its ability to provide sustainable and quality healthcare service to all Indonesians. The affirmative house has to ensure the audience that increasing premiums is necessary for the long-term viability and effectiveness of Jaminan Kesehatan Nasional. So to all the speakers, I hope everyone is prepared for the motions and you can use your time wisely. The first chance of speaking comes to the first speaker of the affirmative house. Are you ready, guys? Okay.
Hello, Sheikh.
Okay. So you guys have 3 minutes each. You can see your time on the corner. So your time begins once you start speaking.
Okay, good evening all. The honorable judges and participants, I'm Rika as the first speaker of the affirmative house. First, from our topic today, we agree that BPJS Kesehatan needs to increase the premium of Jaminan Kesehatan Nasional (JKN) to sustain the program. In the current condition, to achieve the sustainability, the adjustment of the premium should be implemented immediately. As we all know, for the last decade, BPJS Kesehatan has provided numerous advantages to members while collecting underpriced premium. But the current major obstacle is an expected deficit of 11 trillion rupiah in August until September 2025 from the coordinator DJSN. Furthermore, as of December 2023, the JS Kesehatan financial condition has dropped to 4.3 claims, a decrease from 5.9 claims in the 2022, and is predicted to fall again to 2.9 claims in the 2024, considering a realistic limit of the 1.5 times of the claim. But in this condition of the constitutional decrease, insufficient amounts cannot be avoided. The imbalance between the cash revenue and the healthcare expense is the major cause of the deflation in the current financial condition. First, the cost of the healthcare continues is rising, and during the 10 years of the JKN program, the total cost of the healthcare insurance reached 912 trillion rupiah. Furthermore, in the 2024, the ratio between the cost to premium per member per month also impacted to the constantly rising, which 54% in the last 3 years. Due to this implementation of the PMK number 3 of 2023, that is increasing of claim in the accumulation was 7.2 trillion. And this new healthcare rates represent an average increase of 9.5% above the previous prices. Rates for the capitation, non-capitation, in CBGs and non-CBGs all increased through all these times. This is also in line with the uptrend of published of SEP or Surat Elegibilitas Peserta that show that use of the JKN program rise almost 37 in the last 5 years. So moreover, along the needs for more sophisticated medical equipment, the increase in the catastrophic illness, the Indonesian economic condition have gradually improved, and the cost of improving other service quality are the urgency that we should consider to be the sole reason of the increasing premium of JKN program. We suggest implementing the policy gradually. For the example, modify the upper threshold for reporting the maximum salary for PPU, and then begin to increase the premium in the PBI segment as well as a contribution for JKN member in the PBPU segment. And also, so more detail will be explained by my second speaker. Thank you.
Okay, your time is up. Thank you so much for the first speaker of the affirmative house. Next is the first speaker of the negative house. Are you ready?
Oh, yes, I'm ready.
Okay, good. So your time begins once you start speaking.
Good evening, Honorable Educator and team member. Today, I'm Trisna from Negative House. We are debating the motion BPJS Kesehatan needs to increase the premium of Jaminan Kesehatan Nasional to sustain the program. The affirmative team argue that rising premium is necessary for sustainability. However, we on the negative side strongly believe that this approach is flawed. Instead, BPJS Kesehatan should focus on improving the supervising on the JKN program to ensure its long-term sustainability. First, increasing premium is not sustainability solution. Rising premium is merely short-term fix that fail to address the underlying issues. The primary problem that is expense consistently excess income. According to data from Laporan Pengelolaan Program Jaminan Sosial Kesehatan (LPP), while the 2020 premium increase lead to a rise PBPU contribution by 700 billion rupiah. Receivable or piutang also surged to 3.7 million trillion rupiah. The data show that it drastically affects the ability to pay, hence a place an unfair burden on citizens, especially those from low-income background, but also strengthen the financial capacity of regional government. After the premium hike, participant number in the PBPU and PBPMDA segment declined by over 2.6 million, the first decline since the JKN program began. Moreover, the improved financial state from 2020 to 2022 was primarily due to drastic reduction in claim expense during the COVID-19 pandemic, not because increasing premium. This clearly shows that premium hikes do not guarantee financial sustainability. Second, receivable collection is still not done optimally. BPJS Kesehatan has a significant amount of uncollected receivable which undermine its financial stability. By the end of 2023, uncollected receivable across the national total 5.4 trillion rupiah. For example, in Yogyakata, only 2% PBPU segment participant had joined the rehabilitation program by May 2024. This indicated a massive loss of potential income that could support the JKN program. By improving the efficiency of receivable collection, BPJS Kesehatan can significantly increase its revenue without burdening the public with higher premium. Better tracking and enforcement mechanism can help recover this fund, enhancing financial stability without resorting to premium hike. Based on data and argument we present, it's clear that improving collection enforcement and optimizing supervision are essential for the sustainability of the JKN program. Increasing premium is not only unsustainability, but also unfair to the citizens who rely on this crucial healthcare program. Therefore, we urge you to reject the motion and support or stand for a fairer and more sustainability solution. Thank you.
You still have 10 seconds left. Still want to use it?
It will be continued by second speaker.
Okay, thank you. Okay. That's it from the first speaker of the negative house. The next is the second speaker of the affirmative house. Are you ready? Okay, so
Ready.
your time begins once you start speaking.
All right, thank you, the honorable adjudicators. Before the negative house said that the increasement of the JKN premium will affect the ability to pay of the JKN member participant. Here, I like to give the statement that has been spoken by our first speaker and would like to elaborate more why we should implement premium increasement immediately, gradually. First, is because based on Indonesian economic growth data, there is an increasement from 4.74% in the third quarter of 2023 to 5.11% in first quarter in 2024. This relatively strong economic growth rate also improved the welfare of Indonesian citizens. The employment rate could be reduced to 0.54% from previous year. The poverty rate also decreased to 9.36% in 2023, lower even from the pre-COVID period. Moreover, in 2024, based on BPS data, there was an increasement of the average weight of Indonesian citizens until 14%. Even though the plan will cause public sentiment, the government and the society are still considered capable of spending more on the JKN program. Other than that, the reason why we should increase the premium of JKN program is there is an increasement in catastrophic illness. Currently, JKN members are dominated by catastrophic illness who require long-term visit that can be severe and expensive. According to BPJS Kesehatan statistic from 2014, 63.5% of claim expenditures being dominated by catastrophic illness payments. At the national meetings of AMO 2024, it presented that the expense of 13 catastrophic illness reached 25% in 2022 of overall health insurance burden. BPJS Kesehatan has handled over 23.3 million cases of catastrophic illness. It definitely will have a huge impact on healthcare costs in the future. The honorable adjudicators. Next is medical equipment fulfillment at health facilities. Based on the presentation of Ministry of Health with DPR RI on November 7, 2023, 5.6 trillion of dana alokasi khusus has been spent in 2022 and 2023 in order to purchase medical equipment for the treatment of many priority diseases. Furthermore, in 2022, there is 3.55 trillion already been used to buy medical equipment in rural hospital to treat catastrophic disease. The utilization of medical equipment in enhancing hospital quality correlates with the growth in health care costs
Okay,
that
your time
BPJS
is
Kesehatan.
up.
Thank you.
Thank you. Your time is up. Okay, next is the second speaker of the negative house. Your time begins once you start speaking.
Thank you. Our honorable adjudicators, I'm Bunga as the second speaker will now presenting detailed solution continuing our first speaker argument because I think we should focus on definite solutions of our sustainability problems. First, receivable collection is still not done optimally. Even though the second speaker of affirmative team said that there is an increase of the wealth of Indonesian, as the data provided by first speaker, BPJS Kesehatan has a substantial number of uncollected receivables. According to recent audits, improving the efficiency of receivable collection should significantly boost the program's funds. Second, fraud prevention. Fraud within the healthcare system is a major drain on resources. We have data that published in Antara on 7 December 2023 that BPJS Kesehatan has found fraud in JKN program almost 866 billion in 2023, and one of them is claim fiction that submitted by healthcare facilities in Magelang. The other potential fraud that we know from National THBT meeting Quality and Cost Control Team or Tim Mutu Kendali Biaya on 17 July 2024, government budget increases 2 up to 3 multiple by fragmentation, misdiagnosed, upcoding claim, and unnecessary treatment. Result medical audit from TKMKB Jawa Timur Province found potential fraud as much 24,526 cases or 27.24 billion rupiah, which contain prolonged medical rehabilitation, unnecessary PCI claim, and fragmentation newborn claim. By investing in solid fraud prevention measures, BPJS can reduce financial losses. Implementing advanced data analytics and stricter oversight can help identify and prevent fraudulent activities, ensuring that funds are used appropriately and effectively. Third, health promotion and prevention. Investing in health promotion and preventive measures is key to reducing long-term health care costs. By promoting healthier lifestyles and preventive care, BPJS can decrease the incidence of costly chronic diseases. Kumar and Pita's journal, Health Promotion and Effective Tool for Global Health, highlights that lifestyle-related issues contributes to non-communicable disease or NCDs, increasing healthcare costs, promoting health at individual and community levels, strengthening health systems, and fostering multi-sectoral partnership can address specific health conditions. Incorporating health promotion into policies and utilizing setting-based approaches in schools, hospitals, workplaces, and residential areas will lead to positive health outcomes and reduce the financial burden on the healthcare system. That's all. Thank you.
Thank you. You still have 5 seconds left.
Done.
Okay, so we're moving on to the next speaker, which is from the third speaker of the affirmative house. Are you ready?
Already.
Okay. Okay. I want to remind you guys again that you have 3 minutes, so make it worth the time. And your time begins once you start speaking.
Okay, thank you. Good evening, the honorable adjudicators, the negative house, ladies and gentlemen. As we stated before, we firmly believe that adjustment of the JKN premium should be implemented immediately to keep the sustainability of JKN program before facing deficit at 2025. With all due respect, the negative house state the reason why they disagree with all this increasing premium of JKN is about ability to pay and effectiveness of BPJS Kesehatan performance. Concern about the inability of members to pay premium should be also seen about current situation. As stated before, currently the economic growth condition of Indonesia continue to rise based on statistical data from 4.94% in the third quarter of 2023 to 5.11% in the first quarter in 2024. There is also an increasement of the average wage of Indonesian citizens until 14%. This relatively strong economic growth rate also show that there is a room of improvement about ability to pay of the JKN's member. Concern about the inability of low-income individuals who cannot pay premium should be addressed to government with increasing the allocation of MPBN and APBD funds toward increase of JKN premium subsidies. For this issue, we need to enforce government to helping their premium. At the other hand, concern about effectiveness of BPJS Kesehatan performance should be seen to all of our efforts. After the deficit period that BPJS Kesehatan experienced in 2020, BPJS have always improved their performance efficiency. As evidence, BPJS obtained the unqualified opinion predicate over these past 10 years from BPK, which means there is no effectiveness of BPJS Kesehatan performance. Currently, we are continuously improving the efficiency of the service by developing new policies, such as the use of face recognition and fingerprints, the utilization of NIC, and many more. We also continue doing fraud audit process every month, at least 3 medical issues given to carry out. Also, with the change of the organizational structure, there is a new directorate in the focus of fraud prevention, that is the HPPK Directorate. We strongly believe that BPJS Kesehatan already doing optimal effort in managing JKN program. Ladies and gentlemen, as mentioned by our speakers before, the overall views of the JKN program cost has expanded immediately. By the premium underpriced, we cannot deny that currently JKN premium is underpriced. Meanwhile, in this situation, healthcare costs continue rising. We need a stable income from fund immediately. So we need a concrete action that should be implemented immediately to stop widen the current cost gap that keeps happening even as long as we are talking. Thank you.
Okay, thank you. Your time is up. Thank you for the third speaker of the affirmative house. Now it's the turn from the negative team. The third speaker, are you ready?
Yeah.
Okay, your time begins once you start speaking. Time is yours.
Good evening, honorable adjudicators, ladies and gentlemen. Affirmative House still failed to address the real problem and hasn't provided enough data on how increasing premiums can really make JKN sustain. Affirmative House just defined the problem without real correlation on how increasing premium will solve the problem. We have provided the data that the increasement of the premium in 2020 is not affecting our sustainability. The key to our motion is how JKN program can sustain, and it is not the solution to increase the premium. Our team as a negative side of the house have provided enough solutions backed by concrete data saying that we have to deal with the real problem and solve it. We cannot rely on solutions that not even sustainable. You want to rise your premiums every year? It's not a sustainable solution. How can we solve our sustainability problem with an unsustainable solution? We cannot go with just the easy way out, and we need to face it bravely and solve the real problem. And that's not the real problem. Our speaker have break down the primary problem that expense consistently exceed the income. According to data from LPP, in 2020 premium increase, it led to a surging rise of receivable or piutang, 3.7 trillion rupiah. It's not an assumption, it's a fact backed by data. So we are not assuming, we are coming here by the data. And it also shows that pemerintah daerah or government in the regional, they also affected by this rise of the premium. It's shown by the decline by over 2.6 million in the PBPU and BPPemda segment. Our first speaker have spilled the bean, the real blueprint on how we can sustain the program. Because there are times when we actually healthy financially. That is during 2020 until 2022. That is during COVID. So it portrays that if we can manage our expense, doing better KMKB, minimizing or even get rid of any fraud, there is time when we sustain. Adding the fact that we still have a huge amount of receivable or piutang uncollected, more than 5.4 trillion at the end of 2023. Improving collection process is crucial. By enhancing collection effort, we can significantly increase our income without even needing to raise the premiums. In conclusion, we believe that enhancing collection enforcement, fraud prevention, health promotion are essential to the sustainability of JKN program. And increasing premium is neither fair or sustainable. Therefore, honorable adjudicators, we urge you to reject the motion and support our stance for a more effective and equitable solution for our sustainability problem. Thank you.
Thank you from the third speaker of the negative house. Wow, you guys deliver such a tense motion for tonight. Okay, so the next session is listening to the conclusion part from the first theme, and then goes to, I'm sorry, the first is we're going to hear the conclusion from the negative house, and then replied by the affirmative house. In this conclusion, you guys only have 2 minutes each. So use the time well, and the negative team that will give the conclusion, are you ready?
Already?
Okay, so your time begins once you start speaking.
Good evening, honorable adjudicators and team members. As we conclude this debate on whether BPJS Kesehatan needs to increase the premium of JKN to sustain the program, we, the negative team, firmly believe that increasing premiums is not the solution. Our first speaker demonstrated that raising premium is a short-term fix that doesn't address the core issues. The LPP data reveals that the 2020 premium hike led to a 700 billion rupiah increase in PBBU contributions, but receivables surged to 3.7 trillion rupiah. This places an unfair burden on citizens, especially low-income groups, and affects regional government's ability to pay. Additionally, the financial improvement seen from 2020 to 2022 was due to reduced claim expenses during COVID-19, not the premium increase. Therefore, increasing premium is not a sustainable solution. Also, there is a highlighted the issue of uncollected receivables, which totaled 5.4 trillion rupiah at the end of 2023. By improving the efficiency of receivable collections, BPJS Kesehatan can significantly boost its income without raising premiums. Better tracking and enforcement mechanism can recover these funds, enhancing financial stability. Furthermore, fraud prevention is critical. Data from Antara shows that BPJS Kesehatan found 866 billion rupiah worth of fraud in 2023 by investing in robust fraud prevention measures, such as advanced data analytics and stricter oversight. BPJS can reduce financial losses and ensure funds are used appropriately. In conclusion, we believe that enhancing collection enforcement, fraud prevention, and health promotion are essential for the sustainability of the JKN program. Increasing premiums is neither fair nor sustainable. Therefore, we urge you to reject the motion and support or stand for a more effective and equitable solution. Thank you.
Wow, thank you so much from the negative house. Oh. Okay, so be ready for the affirmative house. Make sure that you can convince the judge, the adjudicator for tonight. Remember that you only have 2 minutes for this conclusion part. So your time begins once you start speaking.
Okay, thank you. Okay, for the affirmation reason, what I mentioned before in the beginning, adjustment of JKN premium should be implemented because of the urgency situation. We need to action before we face deficit in the 2025. Remember, we all the effort of the BPJS Kesehatan has made and already mentioned by my third speaker. Deficit are a difficult thing to avoid it unless the current premium are revised. So, BPJS Kesehatan has been done in the 2020, but we still cannot face a deficit again. So what is the long-term fix of the catastrophic illness and healthcare costs? Even we do exactly the negative house suggests how long we can survive with the condition. Okay, in the attempt of the maintain of the program sustainability, we need to stable income to solve the imbalance between the cash and revenue and healthcare expense. We cannot deny the fact that this underpriced premium with all those increasement healthcare costs, the increase in the catastrophic illness, all of these rising costs cannot be solved by only increasing by BPJS Kesehatan quality and performance effectiveness in the long term. While the hope of the participant is to continue to get a quality and equality of service and sophisticated medical equipment, and that continues to increase. How are we improve all of this if we already having difficulty in the financial? So BPJS Kesehatan premium has not changed since it was established in the regulation of the President of Republic Indonesia number 64 of 2020. We believe that this time BPJS Kesehatan is to rise to current premium based on the regulation. And then simultaneously, the Republic regulation of the Minister of Health number third of the Twitter regarding the increase of the cost healthcare service. So this time we need to raise the premium. Thank you.
Okay, your time is up. Thank you.
Good one.
Okay, so the debate session is over. Thank you everyone for the very well-spoken statement. Everyone did well to deliver their opinions and data.
But we speak with English.
Okay, now it's time to let our honorable educator to have a breakout room session to discuss this debate session, and we will get back to you in a few minutes. Okay, see you.
Good evening, guys.
Good
Good
evening,
evening,
Mr.
sir.
Ichwansyah Gani.
Also, all of you, and for also the supporters. Yeah. Okay, go ahead, Dila.
Okay, thank you, sir. First of all, I want to welcome back to our adjudicators. Honestly, it's been a tough decision for our adjudicators, but since this is a competition, we must decide which team deserves to go to the next round. So I would like to invite Mr. Achmad Krisnawan first to deliver the comment. The time and media are yours, sir.
Bro Ahmad, you have to
Ahmad?
give the comment, bro.
Yeah, okay. And thank you. It's really hard for us to, for me to make a decision which one is good. Both of the teams have a good content with the good data support, but it's always there is but. The difference between these two groups, the affirmative have a right to what in English, yeah, to stand up for their topic and should defend their topic. And the other group, the negative, have a right to against the affirmative. In this debate, both of them tried the best to make the situation is balanced. But in my opinion, one of the teams is quite difficult to stand up for their topics, and I think that's because they need more experience to make arguing and try to do their best to stand up for the topics. But both of you is doing the best, and my best out for both of you. I think that's all. Keep fighting, guys. Thank you.
Thank you, sir. Okay, moving on, we have Mr. Ichwansyah Gani. I would like to invite Mr. Ichwansyah Gani to deliver the comment. Time and media are yours, sir.
Yeah, thank you very much, Dila. Since it's debate, we have to find the arguments and the rebuttal, yeah, for the topics. Actually, it's not. We are not just judging your fluency, but also there is a you have to maintain the argument and rebuttal, and not just strictly reading your topic, your preparation that you already made. So that's why we see that the other groups really implement the good method for the debate. They really fight for their opinion, and then there is what we call it, continuity between the other speakers to another speakers, and then they are really doing their debate method, yeah. They giving the arguments, the rebuttal, yeah, for the other speakers in the other groups. So yeah, by our discussion, yeah, as a result for this debate, should I speak for the winner now,
Yes. So,
Dila?
yes.
Okay.
Yes.
Yeah, both of us are agreed to choose the winner of this debate is Yogyakata team.
Well,
Congratulations.
congratulations.
And then
Yogyakata.
the best speaker for this debate is the second speaker of negative themes from Yogyakarta teams.
Congratulations.
Congratulations for all of you. You already done great, yeah. But since this is a competition, since it's the debate competition, you have to follow the rule of the debate. Thank you very much for your participation, and then yeah, we really appreciate for your yeah, for your time to join this debate competition. Thank you, Dila.
Thank you, Mr. Ichwansyah Gani. Once again, congratulations to the winning team, and also for winning the best speaker, which is the second speaker of the Negative House, Yogyakata team. Also, highly appreciated for the other team that already showed us incredible performance for this evening. I hope that today's debate give you an amazing experience, and you may not win today, but definitely you won the competition in our hearts, and you're still open to follow or go with the debate session next year. Okay, so thank you once again for all the participants in this session. We have 55 participants in this Zoom room. Thank you, everyone, for joining our match today. Thank you for the adjudicators, Mr. Achmad Krisnawan and Mr. Ichwansyah Gani. Thank you for your time. Thank you also for the team counselors and all the supporters to both of the team. Okay, see you next round to Yogyakata team. See you in the top 16. And bye. See you guys in the next round.
Bye. Thank you. Thank you.
Thank you for the
Congratulations
good
once
luck.
again.
Yeah, thank you.